I will call the conference committee to order, and we're only going to be able to go till 9 o'clock because the two chairs and staff and the commissioner have a meeting at 9. So we're going to try to go through a bunch of items that don't involve money, and that we hope are not too controversial, although some of them may turn out to be. So I'm going to start. We're going to do Articles 1. What's the other one? 3, 4, and 10, if we can get through those. But the non-money ones. And we're going to start with Article 1, Section 3. And we do have an amendment to that one.
There's an A60 amendment, a technical amendment I'd like to move.
So Senator Lourey moves the A60 amendment, and
this is
completely technical.
This is a technical amendment that was requested by MMB to make sure that the language is clear.
And that's to the Senate.
To the Senate. I'm offering that to the Senate language.
Is there any discussion to that amendment? Seeing none, all those in favor of the Oh, they don't have it. Well, I'll let you read it. It shouldn't take very long to read it.
It's a really nice amendment.
So Senator Lourey has moved the A60 amendment, and staff has told us it's technical. And is there any discussion of the A60 amendment? I don't see any. So all those in favor signify by saying aye.
Aye.
Opposed? So we have now adopted the change to the Senate language.
Mr. Chair, I'd move the Senate Section 3.
Senator Lourey moves Senate Section 3 as amended, and I've told him that we could debate this for hours. One of the things in here requires a report on December 1st of 2014, and the Senate says they want that January 1st of 2015.
Mr. Chair, we argued about this already for hours in the Senate, and we're not even here in December, I think we should...
So any discussion of the Section 3 as amended? Does staff want to just give us a brief review of what that is?
Mr. Chair, Senate Section 3, this and the House Section 3, it requires the Commissioner to seek federal approval to operate a health coverage program for Minnesotans with income up to 275%. The difference is really, if you look on the language, is on R3, and it's the paragraph E are the two, as where the differences are. And as you said, there are different dates. And the Senate then has an extra sentence in there that requires any state financial contribution to implement the waiver to be contingent on legislative action, and that's what the A60 amended. And then there's a technical difference that the staff has already recommended the Senate. And then the House refers to the report on progress on implementing the subdivision, and the Senate in paragraph E refers to reporting on the progress of receiving a federal waiver and on making any legislative changes necessary to implement the waiver.
Okay. Any discussion of the Section 3? Representative Abler.
Well, thanks. Just consistent with my questions from before, if we did this compared to the current law and our Minnesota care improvements, is this going to cost us some money in terms of either now or later? Probably it would, I think, because we're going up to 275 compared to above 138. I know we want to go to 200, but do you understand my question?
Mr. Byrd.
Mr. Chair, Representative Abler, this language only requires DHS to seek a waiver. It doesn't actually spend the money. So, I mean, you can look at it, it implies that we want to go down that road, but this piece of language doesn't actually commit us.
Okay. And Mr. Chair, just to
Representative Aber.
offer my observation, and that's the answer I expected. But as we make these decisions at higher levels of eligibility with richer benefit sets, we'll find ourselves thus able to do other things with the same dollar we might rather have done, like help a COLA with the disability side or like that. So this bill is full of choices like that, at least some. And so I just might make sure members understand what we're buying and what we're getting. So thank you.
Okay, any further discussion? All those in favor of the Lourey motion to approve Section 3, the Senate language as amended, signify by saying aye.
Aye.
Opposed? So Section 3, Senate language as amended is adopted. We're going to hold on that one, right? And then we go to 24. Then we're going to go to Section 24. And could staff describe this? And I think we have somebody who would like to testify on this one.
Senate Section 24 and House Section 24, this requires the health care delivery system demonstration projects, applying for approval to demonstrate how its services will be coordinated with other services that are being provided by other providers and county agencies in the service areas. And these have a number of differences. The House requires the healthcare delivery system to verify that other providers and counties support the demonstration project and are willing to participate. The Senate doesn't include that language. The House also requires documentation on how other providers and counties participated in developing the application for the demonstration project. And the Senate requires a description of the involvement of local providers and counties in developing the application. And then there are, again, a number of technical differences.
Is there anybody that would like to testify on this? Welcome to the committee. State your name for the tape, although I certainly know both of them.
Mr. Chair, members of the committee, Scott Lights with DHS. Mr. Chair, these provisions as we read them are amending the healthcare delivery system demonstration project statute. For members' information, we, starting in January, began a pilot project with 6 what we call HCDSs. These cover about 100,000 of our enrollees, and it's a sort of direct contracting arrangement that we have with provider systems that's fairly innovative and has gotten a lot of attention nationally because it's really working very collaboratively with provider organizations. We are expanding that model. As I understand the language, I think in both the House and the Senate positions, it's really requiring that as those models are expanded and new applicants from the provider systems come in, that they be required to document how they have worked with their local communities around developing the application. Certainly the department supports the providers working closely with social services, public health in the local communities. That's a way that we're going to actually get upstream and save healthcare costs. I think the department's general concern in this one, and I think we've been trying to work with the with the committees and other organizations over time, has been to sort of strike a balance between a project which is pretty new, getting up and running, encouraging provider organizations to participate, while also I think we do understand the desire to have some local input processes. I think we're supportive of that. Our current RFP process does require that to be demonstrated as part of the RFP. And so I think From the department's perspective, we're covering that via the RFP process. I think we would like to make sure that whatever we do to amend the statute currently, while the department, I think, is comfortable with where the statute currently is, if moving forward we decide to do that, I think we want to do it in a way that doesn't discourage additional HCDSs from participating, although we do understand sort of the desire to make sure that there is sufficient and robust local input. So I think that's where we're sort of on this issue right now.
Mr. Lehman.
Mr. Chairman, members, Tom Lehman, representing the Minnesota Association of County Health Plans. I think that members have us to either thank or blame for the House language. We've been quite forceful in seeking greater roles for local counties and local CBPs as HCDSs go forward. As part of that process, in the last few days, we're talking with conferees as well as the department, and I think we are moving in a direction that we're comfortable with, and the department is giving us some of the assurances that prompted our initial language of requiring greater local roles, and therefore I think that from our perspective the Senate language moves in an appropriate direction, and we look forward to. I gave we had some conversations before the meeting, and I don't know that the department's ready to sign off, but I think we're moving in the right direction, and so we're comfortable with the Senate language as it stands.
Mr. Light.
Mr. Chair, I think and appreciate Mr. Lehman's comments. I think from the department's perspective, we appreciate sort of the movement and the flexibility that they've shown. I think there's still some additional work that we'd like to do with the committees moving forward. I think we'd like to work to. I think we had a preference for the Senate language, but I think we'd like to work a little bit more with the Senate, with the conference committees, with the conference committee on that language, just to make sure that the issues that I discussed earlier are adequately addressed.
Representative Abler.
Thank you, Mr. Chair, and I appreciate the testimony. I just wanted to point out to the conferees and the public and the department that I think it's our job to provide hoarse voices, for one thing, but oversight and quality and kind of an overarching protection of everything. And we have a lot of confidence in the department with its RFPs, but I think at the end of the day, it's up to us to be sure that there's real substance. And putting it in the statute, like at least what the Senate has, I like the House better. It's even stronger. But the Senate is reasonable, I think, and balanced. I didn't mean that, Mr. Chair. So anyway, I think that we should do something here and give the department guidance, and then they'll have the security of that guidance as time goes on. Thank you.
So we'll put this on hold and ask the department and the county-based purchasing groups to come to an agreement. Oh, it sounds like you're very close.
Thank you, Mr. Chairman and members.
Mr. Chair, that works so well with us with the provider, the home and community-based service provider stuff.
Okay, let's go to sections 32. And would staff go through these?
Mr. Chair and members,
John.
Senate Section 32 and House Section 32, they both require the Commissioner of Human Services to seek federal approval to implement the Minnesota Care program as a basic health program. There are some technical differences. The main difference is in paragraph C. This is where the House states that the cost of any program changes that are needed to get federal approval become part of base funding for future budget forecasts. The Senate states that these costs shall not become part of base funding. I believe that this is a paragraph that the MMB suggests, I guess, leaving out of the bill.
So,
Senator Lourey.
Mr. Chair, my understanding is that both paragraph Cs would be suggested to be removed. The Senate and the House have differences.
Yes, that's correct.
In paragraph C, and MMB would prefer that neither make it into the
That's correct.
Bill, and then in paragraph B, there's a technical difference and staff recommends the House, is that?
Yes, and then in paragraph A, there's a technical difference in which staff would recommend the Senate. So it's a blend of both, and staff could make the
Well,
conformity.
maybe we just, how many paragraphs are there? There's only the 3. So I would move section 32, House, or Senate rather, paragraph A, and we'll just take them in different motions.
Any discussion of that? Seeing none, all those in favor of the Senate language, section 32,
Section 30.
Paragraph A.
paragraph A. All those in favor?
Aye.
Opposed? So we've adopted paragraph A.
Mr. Chair, I would move House, section 32, paragraph B.
Paragraph B of the House language has been moved. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed? So we have adopted paragraph B,
And that's it?
and we'll just leave paragraph C sitting. And so then we're going to, okay, section 45.
So, Mr. Chair, this is a Senate-only provision, specifies that enrollees and applicants who reside in correctional or detention facilities are eligible for Minnesota Care while they're awaiting disposition of charges.
This is a Senate-only position, and my understanding, Mr. Chen, that these people have not been convicted yet.
Right.
Mr. Chair, yes, that's correct. There.
And my understanding is that the counties are quite supportive of making this change. It'll help them some, as is DHS is also supportive of this provision. And so I'd like to move Senate Section 45 and see if there's any pushback or anything.
I've also heard that maybe DHS would like to come up, so I think they also support this.
You're fine.
Yes.
They're good.
Okay, so the counties support it, and the DHS supports it,
Mr. Chair,
and Representative Abler.
is there a cost somewhere along the line for this? The county saves the money, I suppose.
My understanding, there's no dollars associated with this from the state budget. Representative Liebling.
Thank you, Mr. Chair. And when I looked at this earlier today, it makes a lot of sense. I just wonder, is there any pushback on this from anywhere? I'm just kind of wondering what this would look like, because if somebody's on Minnesota Care and they're essentially under this section, they would be incarcerated, notwithstanding the fact that they're not convicted. So they're incarcerated, and if they're going to be, I guess, is this just if they're already on Minnesota Care that they continue, or
Can apply, can
Is
stay
this-
on or apply.
is this somebody who's going to be applying when they're in jail? I'm just not clear about how this works.
Senator Sharon.
Yes, it's allowing people who are in jail but have not been convicted to stay on or apply for Minnesota Care. It's based on the fact that they're innocent and not proven guilty, and it will help keep costs down for the counties in terms of paying for antipsychotics, and will help people transition more smoothly back into the community.
And so, yeah, that's fine. They're good.
45.
Yep. I've already moved.
Any further discussion of that? Okay, all those in favor of adopting the Senate language, section 45, signify by saying aye.
Aye.
Opposed? So we've adopted section 45. Next is section 50.
And, Mr. Chair, this is a Senate-only provision. It makes a technical change, removing some obsolete language. The department has suggested some alternative language. This is to address Representative Loeffler's concern she expressed earlier about maybe phasing out some existing Minnesota Care provisions prior, or the possibility of if certain Minnesota Care provisions are phased out and there's a delay in implementing the exchange eligibility determination system, there'd be a gap or some complications. So there is an amendment, an A233 amendment that's intended to address this situation.
Mr. Chair, I'd move the A233 amendment.
Yeah, hand it out.
And Mr. Chair and members, what the A233 amendment would do is that it would contingently repeal the section only once the eligibility determination system through the exchange is operational.
Okay, any discussion of the amendment? Okay, all those in favor of the A233 amendment signify by saying aye. Aye. Opposed? So the A233 amendment is adopted to the Senate language 50. And Senator Lourey renews his motion that
I move the Senate Section 50
Senate Section 50
as amended.
As amended be adopted. Any discussion of that? All those in favor signify by saying aye. Aye. Opposed? So we've adopted Section 50 as amended. And next we're going to Section 58. And, yeah.
And Mr. Chair and members, this is language that requires the commissioner to establish a competitive process for contracting with participating entities to offer standard health plans once Minnesota Care becomes a basic health plan. And the difference here is that the House in Subdivision 1 specifies criteria for the procurement process to be used in rural areas other than MSAs. And the Senate does not include this language, and there are also some technical differences.
And again, I think we have people who might want to testify on this.
Or is it the same? I think it's the same.
It's the dynamic duo. Oh, and we're now to triumvirate.
Mr. Chair, member Scott Lice from DHS. I think the department would prefer the Senate position on this particular item as it preserves the flexibility for the department to be able to contract in appropriate ways in various areas of the state.
Mr. Lehman.
Mr. Chairman, members, Tom Lehman again for the Minnesota Association of County Health Plans, the county-based purchasing plans in the state. Earlier this evening, we shared some language with the department, and we're waiting to hear back, but the initial reaction was, I thought positive.
Mr. Chair, I think what Mr. Lehman is saying is that the language moved it closer to where our preferred position would be. I think we still would prefer the Senate position to where we're at now. We, on the other hand, think that with some modifications, the House language may be more appropriate in terms of. What is this? Where are we? We would be supportive of the House language, but narrow to make it clear it applies only to county-based purchasing counties and not to a broader range of counties. And that had been our initial concern.
Okay, and
Thank you, Mr. Chair and members of the committee. My name is Catherine Kmidt from the Minnesota Council of Health Plans. We also have some concerns about this language, and that is that CMS, the Centers for Medicare and Medicaid Services, have clarified that the Affordable Care Act's basic health programs won't be launched until 2015, as we know. And then, according to their timeline, we will not even see proposed BHP rules until September 2013. So while we recognize the need to adapt the Minnesota Care Program in a manner that will allow it to be federally approved as an interim plan for 2014, we believe it's premature to make a more extensive BHP preparation in the absence of federal guidance. And so we would respectfully request that the language be amended to establish a foundation for the BHP while we wait for the federal guidance. And once, then when the federal guidance comes out, then the state and the stakeholders will know what those rules are, and we can develop a more robust BHP legislative proposal for 2014 during this 2014 session, effective 2015.
Commissioner Lights, do you have any comment on that?
Mr. Chair and members, I think the department was generally comfortable with the way the Senate approach was on this. I think actually with both approaches of laying something out, I think we preferred the Senate approach on that. So I think I understand what Ms. Commit is saying, that we are seeking guidance. However, we think that it's probably important to continue to work around what this will look like come the implementation of the BHP. So I think that work can continue, and we probably, while we may need to refine it moving forward, it's probably important to continue to move in a direction that establishes what that baseline would be.
Yeah, I think we will put this on hold right now, but if the three of you can get together and finish up in the next couple of days, we would be ready to go. Representative Abler.
Well, thank you, Mr. Chair. And back to the original piece, not the conformity part, but I think we're going to be sure we don't hurt our county-based purchasing projects. Some of those are very innovative and very effective, and the providers are really happy, and the quality of care is really good. So, not to say anything bad about anybody else, but we want to preserve our successes, just to say that. Thank you.
Representative Loeffler, did you have a...
Mr. Chair, I was just noting that there were some things in here that, we may want to make sure are part of whatever creative process goes. For example, that we have the same providers in Minnesota Care and MA, so that, people who are going to be transferring between those two programs can have continuity of care. And, there's some things here that are beyond, what the interested parties who represent particular HMOs or health plans have concerns. I think it also sets some frameworks, and so I think some of this is useful to just as a statement of an access priority.
Okay. With that, we'll put Section 58 on hold, and we're going to move then to the next article, which is Article 3.
Mr. Chair, there are a couple of, I guess, more technical or clarifying amendments that have been suggested by the department to Article 1. Did you want to go over those tonight or wait till later?
We could.
Let's do them right now.
Okay. So there is an A232 amendment that should be passed out.
Mr. Chair, I'd move the A232 amendment.
And, Mr. Chair, what this does is it makes some conforming changes. In sections that have already been adopted, we provided a definition of participating entities. Lines 5 through 18 of that amendment basically make cross-references to those sections. Then lines 19 through 21, this deals with language already adopted in Senate Section 25 dealing with single-source contracting. That language expanded the groups for which single-source contract could apply to all enrollees. The statutory reference being deleted, which is subdivision 23, applied only to disabled enrollees. So the department suggested adding broader statutory references to apply to all enrollees.
Could you move that?
I did. Move the A232.
Any discussion of the A232 amendment? All those in favor signify by saying aye. Aye. Opposed? So the A232 amendment is adopted.
I believe there's also an A71 amendment.
Chair, I'd move the A71 amendment.
We're on the A71 amendment. Has been moved. So it looks pretty technical.
Yeah. Mr. Chunhar.
Mr. Chair, this is simply instructing the reviser of statutes to change the term Minnesota Insurance Marketplace to the current name Minsure. It's adding something to the existing reviser's instruction in the bill.
Any questions, discussion on that one? All those in favor signify by saying aye.
Aye.
Opposed? So that A71 is adopted. Yeah.
Mr. Chair, I'd move the A103 amendment as well. And while that's being passed out, maybe I'll just describe briefly that this is House-only Section 59, which is a state-based risk adjustment system assessment study, and it was tied to money. It was quite possibly going to need some general fund money off of our bottom line, but in working with the Minsure staff, we've become fairly confident that they would be able to get federal money to support this study. And so this is instructing them to go seek those federal funds and making the study contingent upon receipt of those funds. And doing that, look to see if we could do a better job with a state-based risk adjustment methodology as opposed to the federal one that we're going to be using to get the exchange up and running initially.
Okay, is there any discussion of that? Representative Loeffler.
Thank you, Mr. Chair. I'm just trying to read through this. I know there's been talk in the past about trying to do risk-based or risk adjustment systems that take into account some of the social indicators that affect cost and outcomes, like whether the person is homeless and some of those sorts of things. And I just was wondering if this provides for any examination of those kind of risk factors that tend to make patients more expensive to treat. There's a lot of language here.
Mr. Chair.
Senator Lourey.
This is largely built off of the House risk adjustment, again, so it was House only. You guys did the lion's share of the work on this, but we worked on making sure that we could pay for it through the receipt of the federal funds, and that's the nature of my offer, but we could have somebody from the Department of Health come forward and describe whether it would get to some of those, and the exchanges here as well.
Mr. Chair, as I'm glancing at this, it looks like item 2 on line 1.26, if the data should be further enriched by non-traditional risk adjusters that help in better explaining variation in healthcare costs of a given population and account for risk selection across meta levels. I think that could be interpreted to include that.
Mr. Greenman, welcome to the committee.
Dave Greenman with the Department of Health. Representative Loeffler just said it.
Okay.
Just can't read that.
Any further discussion of the A103 amendment? I don't see any. All those in favor signify by saying aye.
Aye.
Opposed? So we've adopted the A103 amendment to the House language, and that's now in the bill.
Mr. Chair, I'd move House Section 59.
Okay. Any discussion of that? That amendment was basically a delete all of that.
Right, that replaced
59,
House
Article
Section
1.
59, and now I'll move House Section 59, and that would put it in the Conference Committee report.
A1.
Okay, all those in favor signify by saying aye.
Article 1.
Opposed?
Oh, I thought they'd gone to Article.
So Section 59 as amended is adopted. Now where are we? Mr. Chun, was that
Mr. Chair, those are the amendments we are aware of.
Okay, so we're moving into Article 3 and Senate Section 7, House Section 8.
We have an amendment, Mr. Chair. This is the definition, Mr. Chair, I'd move the A101 amendment. And this is the definition of a pacifier, members, and there's a definition of it in the federal regs, and so this just references the Code of Federal Regulations definition of a pacifier. And everybody seems to be pacified.
Yeah, this is to the Senate language, right?
Yes.
Section 7. Any discussion of that amendment? All those in favor signify by saying aye. Aye. Opposed? So we've adopted the amendment to Senate language in Article 7.
Mr. Chair, I would move Senate Section 7.
Section 7, Article 3. So, and that's been moved by Senator Lourey. Any discussion? All those in favor of Section 7 as amended signify by saying aye. Aye. Opposed? So we've adopted the Senate language in Section 7. Next we have Senate Section 10.
Mr. Chair, I had suggested we hold on that, understanding that there had been some potential concerns regarding the disinfectant to be used. I believe that has been cleared up. I'm trying to remember, was there an amendment that needed to be offered to indicate that the label is the law is what we're, is there an amendment?
Representative Loeffler.
Hold on, is there an amendment?
There's no amendment, Mr. Chair, but this is on the Senate floor tomorrow, Senate File 1340, and it's in, this language is in the House Companion Bill, and it's going to be put into the Senate bill with the new amendment. So maybe we should just hold on it here.
Okay, we'll just
hold. Representative Loeffler.
Well, Mr. Chair, I had a discussion with Mr. Kerber about this, who would be in charge of it, and he said actually what needed to be done is the change in the recipe for how much bleach to water, because apparently there's different formulas now, and so we should just say per manufacturer's recommendations was what he was going to come forward with a recommendation on, and so that was my understanding of the issue.
Mr. Chair, that's what's going to be amended on the Senate floor tomorrow. That's the label is the law. You got to read the label. Whatever bleach you buy, there's concentrated. We'll hold on it for today. There is language somewhere, but it's not in front of us apparently.
Representative Abler.
Mr. Chair, at the risk of starting the pacifier swaddling discussion again, we have to put in law that read the label. I mean, I agree, it's remarkable. The amendment's been prepared for the bill I'm carrying, which is the Hayden Companion. So
Well, Mr.
there
Chair,
you go.
Representative Abler, coming from farm country, the label is the law is a really comforting, whole amazingly large body of law over in ag world, and so it's kind of nice to bring it over here. The label is the law. Read the thing and mix your bleach accordingly, and everything's going to be fine.
Mr. Kerber's nodding his head, I think. Okay, moving on. I will put that section on hold and move to Senate Section 14, House Section 15. If staff would like to
Mr. Chair, staff recommends a house on this language. Modifies the family child care training. It's identical except for formatting. The Senate puts a training provision in a paragraph, and the House puts it in a separate subdivision, and it just seems to make more sense.
Is there any testimony on this one? Welcome to the committee.
Mr. Chair and members, Eric Hauge with AFSCME Council 5. The governor had proposed some funding to go along with this provision for training, and so I don't know if that's moves us into the money discussion, but we would certainly support resources for providers to help alleviate some of the requirements for new training. I believe he had recommended $750,000.
Yeah, Mr. Kerber.
Mr. Chair and members, my name is Jerry Kerber from the Department of Human Services, and Mr. Hauge is correct in that the governor's initial proposal was, while increasing the number of training hours and some specific training for family child care providers, there also was an appropriation sought for $250,000 the first year and then $500,000 a year thereafter to supplement or to buy down the training costs for providers. The goal was that the training hours for providers for this additional training was not going to be any more than $5 per hour. That funding was going to be dispersed to the Resource and Referral Network to hold down those costs. The training requirements, that was the original proposal. The increase in training is still very important to us, but I can understand Mr. Hauge's interest in it being funded as well.
Mr. Chair? I'm not sure, but I think this might be different. This is a provision that just states that the commissioner can't impose the new training requirements on the providers until training is accessible. It's not actually requiring the training. Maybe I'm wrong, but
Mr. Chair, Ms. Wright, if that's the only section, that one is not really dependent on funding. What that was doing is for all of the training, the new training that's required of providers. It's just a comfort clause that says that providers aren't going to be required to take that new training until it's made available. Essentially, is what that is.
So, I think that everyone agrees this training is really quite important, and we can continue. It would be funded someplace else, and it just wasn't where the funding was. So, maybe we could move the House Section 15. It looks like fairly similar, identical language. Technical staff recommends House. I'd move House Section 15, and we can continue to determine whether we have the room to put a little funding in at a later date.
Okay. Any discussion? All those in favor of the House language Section 15, signify by saying aye.
Aye.
Opposed? So we've adopted Section 15 of the House language.
Council?
17? Yeah. Section 17.
Mr. Chair,
Ms. Aves.
the department has asked us to hold on that. It's in language that's going to be on the Senate floor, I believe, tomorrow. and the language is different than what's contained in the language in the omnibus bill, so the department has asked that we hold in the omnibus bill for now.
Okay, we'll hold on Section 17 then. Next is Section 2.
This is the 20.
We're not going to
20.
But
We'll just hold on that one.
That's a good one. The House really liked that one.
Okay, the Senate Section 23.
Mr. Chair and members, this modifies the TANF performance-based funds
Wait.
to reward counties that meet or exceed the self-support index, and I do have a technical amendment. Well, part of it is technical, part of it isn't. Or not me, there's a technical amendment to this section. I don't know.
Mr. Chair, I'd move the A81 amendment.
Senator Lourey has moved the A81. Staff described the amendment.
Mr. Chair and members, this amendment moves the effective date of this provision from 2016 up to 2014, and then the rest of the changes are purely technical.
Okay, any discussion of the A81?
Mr. Chair?
Representative Lawler.
Since we didn't have this provision, and it modifies the performance based fund distribution and the performance criteria for counties, I'm wondering if the counties have some concerns about moving it up 2 years, because that sounds like a change in what's being expected. And the amendment here would bring it into effect fairly quickly. I'm not that familiar with where they might be on this one, but we might want to hear from them about changing it 2 years earlier.
Anybody from the county who would like to affirm the Department of Human Services? Welcome to the committee, Ms. Ring.
Thank you, Mr. Chair, members of the committee. I'm Julie Ring from the Association of Minnesota Counties, and I do not have an answer for you right now on this. Thank you for raising the question. We just had a little quick chat in the back, and we're not sure of the answer to the question, so if you can give us a little time, I'll see what I can find out while we're here tonight.
Sure. Well, is DHS here? I believe this is...
DHS, yeah.
I think this is theirs. I don't remember.
It is there.
Welcome to the committee, Mr. Hodge.
Thank you, Mr. Chair, and my name is Larry Hosh with the Department of Human Services. The governor in his proposal originally had 2016 because the performance-based funding used new dollars to give a true bonus to the counties that performed above the expected range of the self-support index. That was funded by money in the tails, so that's why the date was started in 2016. The Senate language does not use new money. It simply uses existing resources with the 95% allocation with the 5% withhold. If counties meet that expected performance, they get that 5% withhold. And because there's no new money attached to it, we can move the effective date up to 2014.
Mr. Chair?
Representative Abler.
First or then?
Representative Loeffler.
Well, thank you, Mr. Chair, but this actually really changes the performance targets from being half based on work participation and half by the self-support index to being fully 100% on the self-support index, which is, I think, a pretty serious change. And, it sounds like the language we should adopt, if given Mr. Hosh's explanation, is really connected to how we want to deal with dollars, because it sounds like the Senate built it into their base and the governor put it into the future, and I think this one just needs some more thought and some more input from maybe the social service administrators and just also in terms of what we do with our budget.
Okay, so we will put, Representative Abler.
Well, I want to echo that. Is this the part that was controversial to some counties? There were winners and losers, and is that a different piece?
That's a different.
This is not that. Okay, thank you.
Okay, well, we'll put this one on hold. Thank you, Mr. Hodge.
And that other piece isn't that controversial.
And welcome back to the House. Okay, Section 24. Ms. White.
Mr. Chair and members, Section 24 authorizes the Commissioner to do TANF demonstration projects. This is budget neutral, and it was the Governor's initiative.
Mr. Chair, I'd move Senate Section 24 and
Any discussion of Section 24? All those in favor signify by saying aye.
Aye.
Opposed? So Section 24 is adopted. Section 26.
Mr. Chair and members, this is a Senate-only provision that freezes the Vulnerable and Children Adults Act at the 2013 formula. This is a Senate-only provision.
Is there any testimony on this one?
Mr. Chair.
Representative Abler.
Well, the comment, I tried to work on this in 2011 and got my hand slapped, so I just want you to know that there's some varying views about this, as I understand. So.
Mr. Chair,
Senator Lourey.
This is a phased-in approach for a new formula for distributing, support monies for vulnerable populations that came out of, Representative Abler did work on this, during the shutdown. It was part of the agreement that ended the shutdown, and the formula really was kind of problematic. I believe there's about close to 50 counties that are real losers on the formula that came out, from under that cone of silence and was just put on the books, phased in. 25% of the money would be distributed based on this new formula in the first year, and that's already occurred. 25% in the second year, so that 50% would be distributed on this new formula, and then 75% distributed under this new formula in the third year, and then full implementation in the fourth year. And there was a great deal, and still is, controversy over this. And I'm not suggesting that the historic formula is perfect and that it doesn't need revision, but there was a lot of real losers. And the way the new formula worked was that of this limited support for counties trying to provide services to vulnerable populations, 40% would be distributed based on the raw number of calls for vulnerable adult reports. 40% would be based on the raw number of calls for vulnerable children reports, and 20% would be based just solely on population. No adjustment for anything, just population. And it really worked to the great detriment of a lot of counties. Some counties were losing up to 69% of their funding, I believe, under this formula. And so what this does is say, it really didn't get enough attention. A 40-40-20 really speaks to a formula that still needed some more work. It's 25% phased in. That 40-40-20 already applied to 25% of the total. What the Senate did was suggest that we stop that rollout of the formula moving forward and don't allow it to apply to the next 25% of the entirety, and just ask the counties to really get together and try to come up with a more fair and meaningful distribution. And it really has been problematic. We did get a number of letters of support for this. Again, I think the number of counties that really lost significantly was 50, approaching 50. And so I would hope that we could adopt this and ask that this be looked at again before we allow for continued implementation of this formula. And I understand, risks can be slapped when you mess with this.
Representative Abler.
Actually, thank you, Mr. Chair. And I was actually referring to me trying to undo or refix the fix. So
Okay.
that's when I, like, ooh, okay. But there's a challenge, and part of what, I'm not sure this is the right formula that we put in, but you seek the right formula. Part of the goal is to encourage smaller counties to consolidate or to coordinate their activities with other counties and get some economies of scale. And that's part of the goal with service delivery authorities, et cetera. And so that's, when you have small counties, the efficiencies just aren't there. And so I don't know what your version does, but I'm glad we can talk about it.
Well, again, Mr.
Senator
Chair,
Lourey.
Representative Abler, it freezes it for the time being at the current level, which is 75% based on the historic distribution formulas of the pot, and 25% based on that 40-40-20 vulnerable adult reports, 40% vulnerable children reports, and 20% population. But that only applied to 25% of the entire pool. 75% of the pool today is based on the historic formula. And again, I think it does still need some more work, but until we really push people, that population-based 20% really is problematic. And I understand some of the consolidation efforts that you're trying to push. I think this is a pretty crude lever to try to achieve those goals. So I'd like to move Senate Section 26.
Okay. Representative Liebling.
Thanks, Mr. Chair. And Senator Lourey, I think I can support what you're trying to do, but a question on line 139.19. I just wonder if this is worded to be what you intended. The commissioners precluded from changing the formula under the subdivision or recommending a change to the legislature without public review and input. So
Where are you at?
I'm on page 37, line 139.18 to 0.20 there. I'm in the right place, right?
Mm-hmm.
We're on section 26? Yeah. And I just wondered, so are you saying that the commissioner should be precluded from even recommending a change to the legislature without prior public review and input? I usually think of coming to the legislature as where you get public review and input. So I just wondered if that was maybe not worded the way you intended.
Mr. Chair, we could try to change that a little bit. The commissioner, we do try to get the commissioner to do some stakeholder work before coming to the legislature, and I would hope that they would to do that. I think that's really what it is. Certainly there would be more public review and input once we got to the legislature, absolutely. But I think what this is saying is get some broader stakeholder buy-in before bringing forward another proposal.
Representative Liebling.
Okay, I guess, Mr. Chair, Senator Lourey, if that's what you intended, I guess that's okay. It just seems a little strange to me because the wording here is pretty, the commissioners precluded, that's pretty strong language to say you're forbidden to come to the legislature unless you've had, but, it's not, I'm not going to fight you over it, but I just thought I'd bring that to your attention.
Okay, I was going to ask if there's anybody in the audience who wanted to talk on this one. Don't see any. So Senator Lourey renews his motion that Senate Section 26 be approved. All those in favor signify by saying aye. Aye. Opposed? So Section 26 is adopted. And next we have House Section 26. And
Mr. Chair.
Hey.
This is a House-only provision, and it just clarifies that each ombudsperson that's appointed by one of the community-specific boards is to act independently, but in collaboration with the board.
we don't have any history with that. We have to find it. Do you know where it came from in the House, Mr. Chair?
Section 23.
Oh, I remember that. Yeah, I do recall some conversations about that. Maybe, well, I'd move House Section 26. Maybe you could see if there's anybody who wanted to testify.
Does anybody want to testify on that? No? Okay. I think Representative Allen had that.
Okay.
Okay, any discussion? I don't see any, so Senator Lourey renews his motion that House Section 26 be approved. All those in favor?
Aye.
Aye. Opposed? So House Section 26 is approved. And next we're going to Senate Section 34, and the House has a bill with that in it.
Mr. Chair and members, it's my understanding that there's still, the Senate doesn't provide any funding, nor does the House for this provision, but there's still some outstanding issues related to whether or not funding is necessary, so you might want to hold on this.
So, Mr. Chair, over here, that's my bill, and I think the language that is in question is around the mailing of the notification, and I would like to accept, if possible, the Senate position.
Okay, is...
No.
I think
How do they?
there's a cost to this.
How do they notify them?
Okay, is there anybody from DHS that could testify on this?
Mr. Chair, I have a question.
Senator Hayden.
So, Mr. Chair, Representative Moran, it looks like our position is that they must provide notice to the obligor, obligee, et cetera, et cetera. So how do they inform them? How do they give them notice?
So for, Mr. Chair, included in my bill, it was referenced that it would be by certified mail. I think in the Senate language, it discussed two mailing to the obligee and the obligor. So that was the difference in the language.
That it was just, Mr. Chair, Representative Moran. So you're saying that it just doesn't have to be by certified mail? Correct. They were just regular mail.
Welcome to the committee.
Mr. Chair, members of the committee, my name is Ralph McWhorter with the Minnesota Department of Human Services, and just I wanted to acknowledge that we did indicate there was a fiscal impact on this related to MFIP grants, actually, because it would affect the amount of the MFIP grant as a result of the child support collected on this. And we also identified costs for systems for the prison information system to make the modification. And then we had a small cost for the notification process.
Yeah. You know, this is, Mr. Chair, in the Senate, this was a Marty provision, if I recall correctly, and the argument on the first piece of the cost, which was the lion's share of the cost that was attributed to this, we put it on here and didn't carry the costs because, correct me if I'm wrong, the argument went something like this: with these old cases that are 3 years in arrears with an emancipated youth, you know, there are sometimes cases, I believe, like 3% of collections, I want to say, or something, are sometimes achieved, and the counties testified fairly convincingly, in my opinion, that they can still find those cases, and it is in their very best interest as well to pursue those cases and keep them around. But these county workers are trained pretty well and know which ones are likely to provide some fruit for their continued pursuits and which ones aren't, and that they spend a great deal of resources chasing these cases that they're just not going to get resolution on, and they chase them for years and years. And The cost was attributed to the fact that those ones the cases that may be able to be found if and recovered on, if that was all lost, there would be increased MFIP monies to those low-income families if those recoveries were not able to be had. But the counties were pretty insistent that they'd still be able to keep these cases open and be able to find those ones. And I thought they made a pretty compelling argument. I don't know if they wish to come forward and try to work on that a little bit again tonight, but...
Mr. Chair, if I could also respond to that. We did hear from some counties about that as well, and we looked at that, and we know that some individual counties have certain experiences. We looked at it more broadly, and we believe the language is broad enough that requires us to supplement the MFIP forecast aspects of this as well. So I do believe any individual county will have a specific perspective on this. We were looking at it statewide, and from our information, we believe that our forecast adjustment was called for.
Welcome to the committee.
Mr. Chair, members of the committee, my name is Claudia Brewington, and I represent Ramsey County. We brought this bill to Representative Moran and Senator Marty. There are those cases where we have done everything that we can to collect, and we can't collect. We are required to continue to pursue all the options while that case is open. In closing a case, we feel that we will also have some increased collections with other cases where there is a chance of collecting, because we will have staff time freed up instead of chasing down something where we can't collect. We actually will be able to collect. So while there may be some minor costs in one area, we feel that there will be some gains in the other area as well when we're pursuing those cases that are more likely to be collectible. I would also add, Mr. Chair and members of the committee, that when we initially heard that there may be a fiscal note attached to this, that we reached out to staff at DHS and indicated that we would be willing to do some of the footwork to implement this at no cost, that the county would work with them to initiate the changes that need to be made. Obviously, we can't do all of them, but to help out on our end as well.
Senator Hayden.
Well, thank you, Mr. Chair. And it seems to me that I remember that on those cases that were outstanding over a certain period of time, that there is a and help me with the language. You have some federal goals that you have to meet in terms of collections, and that these older cases kind of work against your goals as well. That could have some ramifications. Could you guys help me with that as well?
Mr. Chair, Senator Hayden, that's correct. We have performance requirements at the state we have to maintain at a certain level above there's actually a range of them, and 75% of the range of them. But it is an issue. We're not opposed to the proposal. Our issue is just to cover the cost to do the PRISM changes, the mailings, and we think there's a forecast effect as well.
So, Mr. Chair, Mr. McWhorter, what happens if you don't meet your federal goals? Is there a penalty in terms of the funding that the feds give you to do this work?
Mr. Chair, Senator Hayden, I'm actually not the expert in this area, but I believe there's a program improvement plan, so it's not quite as clean as there's a reduction right away or anything. We work through a process. We have a time to work through. We have come up with a plan and a review by the federal agency.
So, Mr. Chair, I think you see the road that I'm going down. I think that what Senator Lourey was saying was not only does it help the counties in terms of their efficiency to find the dollars and to get the staff on and to figure out where those arrears may be versus the ones that they know that they can't collect on, but it also has some far-reaching, some other ramifications in terms of their federal performance plan. So I've been a proponent of this for a long time. Plus, I feel like a lot of the dollars that you chase and that you try to track down often, I've never been really told, frankly, where those dollars go because they're, well, anyways, I won't go into that. I think that's far afoot of this issue, but I think it's something we should support.
I don't think we have a problem. This is going to cost the general fund money.
Mr. Chair, before we let it go, can you just, do you recall what were the MFIP costs?
I have them here.
And the PRISM costs as well? The PRISM costs were kind of surprisingly high, too. Is that a manual process or something? I'm trying to recall.
Mr. Chair, Senator Lourey, the PRISM cost that we have identified is $36,000 the first year and $7,000 ongoing. But a lot of that is not just we have to do the testing and the documentation in the system as well. And then there's actually the training aspects of changes to PRISM for county workers. The MFIP costs go from $27,000 the first year up to $115,000 in fiscal year 17. So we're not talking about large amounts of money, but we're talking about the fiscal impact of the proposal.
Mr. Chair?
Representative Loeffler.
Well, thank you, Mr. Chair. And I know that some things require computer programming, but sometimes, you know what, we can just set a rule and let the counties comply with law without having to change the computers. They actually can make some of those decisions when they're given guidance. And if you look at the language on R45A, it's pretty clear. It's a may, so it's not a must. So I think when it's a may, it doesn't need a computer program. It gives some discretion to the counties. And it says the arrearage is under $500, and it is considered unenforceable by the public authority because there have been no collections for 3 years. That's pretty easy to figure out. All administrative and legal remedies have been attempted or are determined by the public authority to be ineffective because the obligor is unable to pay, the obligor has no known income or assets, and there is no reasonable prospect that the obligor will be able to pay in the foreseeable future. And it just says when that happens, you get to send 2 notices. And if the person who's owed this money says, you just keep on going after him, he's lying, he's hiding something under the bed, whatever, you got to keep doing it. This just says when everybody involved agrees it's totally hopeless, the kids have grown and gone on their own, we let it go. And I think we should be able to let it go without having to reprogram computers, and we're just giving some discretion to the county when there's kind of a hopeless case.
Mr. Chair. I also can't find the logic in, if you're not collecting the money as it is, why that there would be an impact on the MFIB program, because you're not collecting the money, so you're not passing it through. Mr. McWhorter, I guess, Mr. Chair, Mr. McWhorter.
Mr. Chair, I might advise the committee that I could bring someone tomorrow to have this discussion. But what I would say is that we can't have individual notes going out to the county workers about how to perform activities in these programs. We need to be able, we actually have monitors and federal monitors who come in and look at how we perform. And so we need to have documentation. We need to have it effectively enacted around the state for this program. And so to have individual items that you get to do it this way is a difficult situation for us. Working with those federal monitors.
Why don't you bring somebody in tomorrow and that can clarify the fiscal note on this one. And so I would like to thank you for your testimony. We'll put this on hold right now.
Thank you, Mr. Chairman.
This is difficult.
Okay, well, now we're going to House Section 36.
Mr. Chair, this is a House-only provision that instructs the Minnesota Interagency Council on Homelessness to include in its statewide plan strategies to reduce youth homelessness. It's not establishing any new duties. It's just phrased so that they will do that as they're updating their statewide plan. I believe this was a bill by Representative Lourey that had a cost, and the language has been massaged so that there is no cost anymore.
That's good.
All right, I'll move House Section 36. Representative Huntley just said it's good, yeah.
Any discussion? All those in favor of House language in Section 36, signify by saying aye.
Aye.
Opposed? So we've adopted the House language 36. And next is House language in 32, which is a Clark bill, I think.
32? Hold on.
Mr. Chair,
Ms. Aves.
in the side-by-side, it is on R46 at the top of the page on house language. It's just changing an effective date in laws 2011 to state that the effective date for the restriction of child care assistance program funds for providers who care for their own children is extended until July 1st, 2014.
And Ms. Aves, what section was that again?
It's section 32, it's the top of page...
14.
Okay.
The bottom of page 14 of the side-by-side.
It's R41.
Oh.
It's on page R46 of the side-by-side language.
Is there any testimony on this whole thing? Well, no, it's goes to July 2014. Right here. House section 32. And it's just moving a date out a year.
It's an effective date.
I think we'll, this one I've been talked to about, I'd move House Section 32. It just moves this out a year.
Any discussion of House Section 32? All those in favor signify by saying aye.
Aye.
Opposed? So House Section 32 is adopted. Okay. And next we are going to go to Article 4.
Mr. Chair.
Representative Lourey.
Well, just before you move, I'd like to call attention to one section of Article 3 for the Senate's benefit. Senator Lourey. Section 19, which is on R23. And it's 2 pages long. Actually, there's something called banked beds. And we were trying to find some ways to get part of the sex trafficking efforts have been to get safe housing. It's on page R24 and R25 of the House.
Of Article 3 stuff?
Article 3, yeah.
Oh, I put page to Article 4, okay.
Oh, yeah, that's why I'm trying to catch it before you run off.
Struggling here.
Oh, yeah. Anyway, so I was talking to the department, and they have a program called banked beds. And we're paying for these beds. And what they tell me, and you can sleep on this, is that they can designate the active language is on 362.9 and 10, which is the bottom of R25. And for no additional cost, they can set aside 35 of these beds to be used for the purpose of sex trafficking victims. And they would be spread around the state. And so I thought it was kind of cool. And these are related to general assistance and GRH kind of beds. Something like that, as I understand. I'm not suggesting to move it today. I just wanted you to understand it. And it wasn't, because if you remember, one of the proposals was to create 35 beds for victims of sex trafficking. And there was a quite expensive proposal to do that. And so maybe you can do whatever is going to be done besides, but here's 35 beds that could be available scattered statewide, perhaps in 4s or 6s or something, to give places for the police to take these young people rather than to jail, which is the whole point of the sex trafficking effort. So I just wanted to call that to your attention.
Well, that's a financial measure.
No, it's, Mr. Chair, there's no charge. It's without cost, without additional cost. Nothing's free, but there's no, we're already paying for these beds, and they're banked, so there's no cost.
Did we, Mr. Chair, did we get testimony from DHS on this? I've got...
That's Abderholden. Did you have a position on this one? No. Recorder's coming back. I think, my understanding of this, the debate is, are these bank beds in facilities where these young girls could be put into a facility where only other young girls like them are located versus have them put in with whoever happens to be there. And there's a pretty strong feeling that they should be put into facilities where there are only people like them that can be treated.
And Mr. Chair, you and I agree on that. This doesn't say anything about the makeup of the beds. I think the department would agree with you as well. They wouldn't put them in a DD site or a TBI or something, but there's Mr. McCorder will tell us about the banked bed system, but there's 100 or more beds that are scattered around that we're paying for that don't do anything. And by consolidating these, they could turn into kind of the service network for some of those kids at various sites. So that's the intention. And I'll yield to Mr. McCorder, who knows more about this than I do.
Mr. McCorder.
Mr. Chair, members of the committee, my name is Ralph McCorder of Minnesota Department of Human Services. This topic did come up, I'm going to guess now, several days ago. The issue that we identified was that, as written, this language appears to us to have a cost because there's no language about how we would manage that, and that we gave some advice that we would need additional language because we don't know exactly where the bank beds are. That's under the control of the counties under the moratorium. And I remember Representative Loeffler raising concerns at that last discussion about that issue, about how we would go about managing the actual beds. And Representative Abler was not in the room during that discussion.
Mr. Chair.
Representative Abler.
Well, this language came from the department at the first meeting I had, and I forget the woman's name. But I think that they were, as the department's testimony in that meeting was, that they were trying to get a handle on these bank beds, and there's more than 100, and we're paying for them, and we're getting nothing to show for it, which is, and some counties want to hang on to their bank beds, and that's lovely, but I don't think it makes sense for us to pay for empty beds, and so that was the idea. So I'm glad it's coming up now, so at least it's brought forward. But it seems that whatever we do with these beds, the counties, the state should, if we're paying for them, should have control and put them to good use. So that's my effort, so thank you.
Okay, thank you. So what...
Before we move on to Article 4, the department's saying we've got to fix this risk adjustment system. Can I do that right now?
Sure.
Mr. Chair, I'd like to reconsider the vote by which the A103 amendment was adopted. The department has come forward and wanted some clarification on the dates that would be the service dates that this would apply to, and so there's a technical amendment to offer to that A103 amendment.
So, Senator Lourey moved to reconsider the A103 vote. All those in favor? It's 2 votes. All those in favor of reconsidering signify by saying aye.
Aye.
Aye. Opposed? Okay, Senator Lourey, you
And then
make your
staff
motion.
can describe the amendment and why it came about.
Mr. Chair and members, on line 9, if you strike in and say beginning October 1, 2013 through December 31st, 2014, comma, and then on line 10, strike calendar year 2014, comma. And what this does is that for that initial phase, the commissioner would have a year and 3 months worth of data. It just gives them 3 more months worth of data to figure out and study for the risk adjustment. And that was a request by the department.
Mr. Chair, I'd move that oral amendment.
So he moves the oral amendment to
A103.
To A103. Yeah. And Senator Liebling, Representative Liebling.
Thank you, Mr. Chair. I just wondered if we could have it repeated. I had a little trouble finding the A103. I mean, they're not exactly in order. It doesn't help to orient us to where to find the thing, and this was an amendment that was, it was amending R43 in Article 1, so just so if other people don't know, and if we could just get the oral amendment again, it would be helpful.
Mr. Chair, okay, so we've got the A103 in front of us. Line 9, page 1, line 9, delete in, and then insert beginning October 1, 2013 through December 31st, 2014, and then on line 10, strike or delete calendar year 2014, so it'd be for service dates beginning October 1, 2013 through December 31st, 2014.
Thank you.
Okay, any further discussion of the amendment to the oral amendment to the to Amendment 103? All those in favor signify by saying aye.
Aye.
Opposed? So the 103 amendment is now amended. No, we haven't adopted.
Do you want us to adopt this back into the conference committee report?
Yeah.
Okay, so then I'd move, again, House Article 1, Section 59, which is now as amended, back into the conference committee report.
Okay, so he moves the amendment as amended. All those in favor signify by saying aye.
Aye.
Aye. Opposed? So that amendment is readopted as amended.
Representative Huntley? Representative Huntley over here?
Nope. Senator Sharon.
Are we back then to Article 3? I just was unclear as to where we left what Representative Aber was talking about as a possible resource for beds for sex trafficking. Where have we left that as something that's we're going to get further information about? Is that what that's going to be about?
We're putting that on hold, and there's a question over the money as well, and Mr. McWhorter wanted to bring somebody else in tomorrow that is a little more familiar with this than he is. So we'll deal with that, well.
That's on the last provision.
What?
That was on the last provision.
Okay.
That's all.
So.
Thank you.
This one we held in this amendment. To what section?
We did that one, didn't we?
We
held it. Okay. Mr. Chair, I'd move the A81 amendment. We've heard back from the counties, and they're fine with moving that date from 2016 to 2014, that technical, back in Article 3 before we move on. The A81 amendment.
So, Senator Lourey moves the A81 amendment in
Article
3. And that's the TANF performance-based funds. Any discussion of that? Seeing none, all those in favor signify by saying aye. Aye. Opposed? So that the A81 is adopted. We're going to 4.
Then, Mr.
Now
Chair,
we're going to section, or Article 4.
Hold on.
Mr. Chair, the A81 amended the Senate Section 23 in Article 3. I'm not sure if you want to adopt that section now.
Mr. Chair, I'd move Senate Section 23 of Article 3. We will get to Article 4 pretty soon. I think it's the 5th time we've tried to flip to Article 4.
Okay, all those in favor of that section signify by saying aye.
Aye.
Opposed? Okay, so that section as amended is adopted.
Right.
Section 10. Senate. Okay, we have Senate Section 9, and the staff can go through it, and then we have people that want to testify.
Article 4, Section 9.
Mr. Chair and members,
Wait.
Senate Section 9 modifies the Commitment Act to require the Commissioner to prioritize patients being admitted from jail or a correctional institution within 48 hours.
There are people who wish to testify on that one. Welcome to the committee.
Thank you, Mr. Chairman. Jim Franklin, Executive Director for the Minnesota Sheriff's Association. I'll be very quick and brief. As you know, we hold a number of people in our jails that are mentally ill or have deficiencies. We are talking about Rule 20 hearings where the person has been committed for mental illness. We are asking under this bill to have them removed from our facility within 48 hours. We made some modifications to the bill. We believe that that's a good policy. Secondly, as you know, when you hold people and once a determination is made, if we extend the period of time that they're on hold, disciplinary and actions create problems. So we think the sooner that we can get them treated and into a treatment facility, the better. We are just not a mental health facility that has adequate training and facility resources to adequately care for them. So we'd like to have them moved as quickly as possible, and this bill does that.
Thank you. Any questions? Ms. Abderholder.
Mr. Chairman, members of the committee, Sue Abderholden with NAMI Minnesota, and I just want to say that we also support this provision and worked with the sheriffs and other folks on it because people do decompensate and sometimes they've been in there for months, which really is just not okay. So we support this provision as well.
So anybody from DHS wish to testify?
Right.
Welcome to the committee.
Thank you. Good evening, Mr. Chair and members. My name is Joanne Jones. I'm the interim legislative director for the Chemical Mental Health Division and State Operated Services. Just here tonight briefly to speak on behalf of DHS and that we would request, we did submit an amendment to put weekends and holidays back in to this language, just to be consistent with our 72-hour hold. And if the committee would desire, we can perhaps come back or revisit this. I do have a copy of the amendment with me as well.
We can put it on hold.
So we'll put this on hold. Thank you, and you can bring that amendment up.
None of us. You got it? Okay.
So, thank you.
You're welcome. Thank you.
And which one was that?
Because that's what they do for everybody else.
Mr. Chair.
Representative Lewin.
Thanks, Mr. Chair. Just going back to that provision that we were just discussing, Section 9. I mean, it sounds like a really good idea. I mean, we all, I think, will agree that a jail is not a place to hold somebody who's suffering from mental illness. But I'd just like to understand a little more this is about prioritizing. And I'd just like to understand a little bit more the impact on the queue, if there is one. I mean, I assume that the reason that this is being offered is because there's a waiting list. And I assume that that waiting list is different in different areas of the state. But I guess I'd just like to understand a bit more about the problem. Maybe we could do that when they come back with when the department comes back with the additional language. But I would like to hear a little more about that.
No, it's not. So let's go on to sections, Senate sections 20 and 21.
Mr. Chair and members, these sections establish a new behavioral level 2 mental health aid, and this bill is also traveling separately in Senate File 266, which had its second reading on May 7th.
Is there any discussion of that one?
I'd be happy to move this.
Representative Lawford.
Well, thank you, Mr. Chair. Since we didn't hear this, I'm just wondering if a level 2 behavioral health aid is something that's sort of nationally recognized as a health profession, and we just haven't adopted it here, or is this going to be a uniquely Minnesotan kind of designation? I don't recall us hearing this bill, so we don't have the background on it.
Sharon.
I have a form that I think could be handed out. I've asked Sue Abderholden to describe some of these provisions, and if somebody wants to pass these out, some of these have financial obligations, some don't. And I would ask Sue to come to the table. This one is a partnership with the MNSCU system to develop a certification program. Right now, the providers have to recruit and train these aides, so this is just a way to have a specific curriculum developed and a certification put in place. MNSCU's very willing to do this, has been at the table and engaged and wants to be involved in this. And this does not have a cost associated with it, and I see that Ms. Abderholden is here.
Ms. Abderholden, welcome back.
Thank you, Mr. Chairman. Sue Abderholden for the record. Currently, in our statute, we have mental health behavioral aids 1 and mental health behavioral aids 2. So they are existing in Minnesota law. The problem has been because providers have to recruit people and then train them, we only have a few, and it really is a way to build up our workforce. We modeled this after the community health worker law so that people can, go to a community college, get the certificate to be a community health worker, and then different organizations can hire them. So we thought this might be a way to, again, to kind of increase our workforce because people can just go and get the certificate and then go to any mental health provider, CTSS provider that there is, and get hired. So we really saw this, again, as a way to help expand our workforce. MNSCU is very supportive. Minneapolis Community College already said this is terrific. They already have ideas for putting together the different, they think they already offer a lot of the courses, which is why they said it wouldn't cost any money. So it really is, kind of a motherhood and apple pie kind of provision.
Okay, would somebody like to move that?
I move that.
That's the Senate sections 20 and 21.
I know.
So Senator Sharon moves sections 20 and 21. Is there any further discussion of that? All those in favor signify by saying aye.
Aye.
Opposed? So sections 20 and 21 of Article 4 are adopted. And we had skipped section 10, and I understand there is an amendment to that
Mr. Chair.
in Article 4.
Mr. Chair.
Nope. Ms. Hay.
There's an amendment to this section, the A247. It's language that was suggested by DHS. NAMI agrees with it, and it's Representative Abler's language, and he supports it too. So I think we've got everybody on board that didn't agree with it. What this amendment does, it deletes the current language in the bill, and it amends the definition of mental health practitioner. It deletes the requirement, or strikes the requirement, that a mental health practitioner who holds a master's or other graduate degree has to have less than 4,000 hours of postmaster's experience. This would allow people to continue to work as a mental health practitioner for longer than the 2 years. There would be no cost according to DHS because it would not create any more professionals.
Yeah, is there something? Yes, and here she comes. Nope.
There she goes.
Anybody from DHS wish to comment on that one? And NAMI, do you wish to testify? But she does support it. Okay, any further discussion? Somebody, let's see.
Mr. Chair,
Yeah,
I can
somebody
move
needs to
it.
move this.
I'll move the A247, please.
Abler moves the A247 amendment to section 10 of the House language. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed? Okay, and so now we have section 10 as amended. And
Mr. Chair, I'll move the amended
Like to move
section.
that?
I'll make whatever motion you need to move the amended section.
Well, the amendment's approved, but now we have section 10. And Representative Abler moves section 10 as amended. Any discussion of that? All those in favor signify by saying aye. Aye. Opposed? So section 10 as amended is adopted. Where are we? 27?
No.
Nope, no. Okay, section 27 of staff discussed that.
Yeah.
Mr. Chair and members, Senate only, Section 27.
Yeah, Ms. White.
Establishes the mentally ill and dangerous commitments stakeholders group to develop recommendations for the legislature that address issues raised in the February 2013 OLA report.
Representative Huntley.
Anybody can discuss? Senator Sharon.
Well, when we went through this before, this is just in the Senate language. This followed the report that came on state-operated services from the Office of the Auditor, Legislative Auditor. And so this directs the Commissioner to pull together a stakeholder group that crosses over and invites the judiciary into a process of taking a look at the civil commitment process for the mentally ill and dangerous. There are similar kinds of problems in our civil commitment process for the mentally ill and dangerous, and the review process for them that relates to how long they're staying and how the process by which we review that. So this simply asks the Commissioner to pull together a group to take a look at the recommendations over the summer of the Office of the Legislative Auditor's report, and they supported this language.
Representative Loeffler.
Thank you, Mr. Chair, and this sounds like a good way to proceed. I just know that there were some serious recommendations in the report that I thought were going to be more quickly implemented. Does this in any way delay anything that the department would intend to act on more quickly? I don't know.
Representative Huntley, the auditor requires a quarterly report from the department on, and in the report, if you remember reviewing it, all of the recommendations of the auditors had a response from the department of sort of a strategic initiatives that they were going to take, and I anticipate that they will proceed with those. And I know that in the Senate we're going to ask for meetings with the representatives addressing the issues in the state auditor's report on a quarterly basis to make certain that those activities are responded to. So I think the simple answer is no, it doesn't stop them from proceeding with other kinds of activities that they're engaged in. This is only related to one specific component of the auditor's report around the civil commitment process.
Thank you. Sounds like a good idea.
Okay, any further discussion of, would somebody, can't remember, did you move that or?
I have not moved that, but I'd be happy to.
Okay, so Senator Sharon moves
Section 27.
Section 27 of the Senate language. Any further discussion? All those in favor of Section 27 signify by saying aye. 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 Opposed? So Section 27 is adopted, and the last one in this article I think we're going to deal with today is Section 18.
Mr. Chair, Section 18 is a House-only provision. It instructs the Commissioner of Human Services to work with counties at the request to help facilitate discharge of clients from Anoka and the Minnesota Security Hospital.
Any discussion or question?
I'm not sure what you said.
Could somebody from DHS come up and see if there's a class? We don't think there is, but welcome to the committee.
Thank you, Mr. Chair and members. Joanne Jones, DHS. Section 18 relates to our state-operated services effort to transition clients out of, and most specifically, those that can be on waivers. We specifically have not done a fiscal note that I can recall on this particular language. And so if the committee will allow us to be able to go back and do that, to be able to come back to see if there would be a cost associated with this, that would be appreciated.
Okay, we'll put that one on hold. So thank you for your testimony.
Thank you.
And
They're just discovering that they need a hospital.
Article 10, but I'm going to take about a 5-minute break here first. So we're going into recess for 5 minutes.
I thought this was over.